Welcome. Today we're diving deep into the world of liver diseases, specifically focusing on hepatitis E. This often overlooked infection can have serious consequences, so let's explore its causes, symptoms, and how to protect ourselves. Hepatitis E is primarily caused by the hepatitis E virus, or HV. This virus is typically transmitted through the fecal-oral route. This means that HV spreads when someone ingests something, usually water or food, that has been contaminated with the feces of an infected person. In developed countries, rare cases have also been linked to eating undercooked pork, deer, or shellfish. While less common, mother-to-child transmission during pregnancy is also possible. Once HEV enters the body, it targets the liver cells, known as hepatocytes. The virus replicates within these cells, leading to inflammation and damage. This inflammation disrupts the liver's normal functions, like filtering toxins, producing bile, and processing nutrients. The body's immune system also contributes to the liver damage as it attempts to fight off the viral infection. The severity of liver damage varies from mild to severe, depending on the viral load and the individual's immune response. Hepatitis E has a global distribution, but it's much more prevalent in areas with poor sanitation and hygiene. These regions include parts of Asia, Africa, Central America, and the Middle East. In developed countries, hepatitis E is relatively rare and often linked to travel to endemic regions or consumption of certain undercooked meats. Outbreaks are common after heavy rainfall or flooding that contaminates water supplies. The symptoms of hepatitis E can range from mild to severe. Many individuals, especially children, may not experience any symptoms at all. When symptoms do appear, they are often similar to other viral infections. These can include fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, dark urine, and jaundice, a yellowing of the skin and eyes. In rare cases, particularly in pregnant women, hepatitis E can lead to acute liver failure, a life-threatening condition. Diagnosing hepatitis E typically involves blood tests. These tests look for specific antibodies against the hepatitis E virus, indicating a current or past infection. Another test used is a PCR's polymerase chain reaction test, which detects the viral RNA itself. These tests are crucial to differentiate hepatitis E from other causes of liver inflammation. Hepatitis E is generally classified into different genotypes. Genotypes 1 and 2 are typically found in developing countries and are transmitted through contaminated water. Genotypes 3 and 4 are more common in developed countries and are often linked to the consumption of undercooked meat products. These genotypes can also differ in their severity and the populations they affect. In most cases, hepatitis E is a self-limiting illness, meaning it resolves on its own without specific antiviral treatment. Treatment typically focuses on supportive care, such as rest, adequate hydration, and avoiding alcohol and other substances that can further damage the liver. In rare cases of severe liver failure or chronic infection, which is rare but can occur in immunocompromised individuals, antiviral medications such as ribavirin may be used. However, these medications should be used with caution due to potential side effects. Prevention is key in controlling the spread of hepatitis E. This includes practicing good hygiene, such as frequent hand washing with soap and water, especially after using the restroom and before preparing food. Avoiding the consumption of contaminated water and undercooked meat, especially in endemic areas, is also crucial. A hepatitis E vaccine is available in some countries, and its use can significantly reduce the risk of infection, especially for travelers and individuals living in high-risk areas. The prognosis for hepatitis E is generally good, with most individuals making a full recovery. However, pregnant women are at higher risk of severe complications, including acute liver failure and death. Chronic hepatitis E can occur in immunocompromised individuals, such as organ transplant recipients or those with HV. Recent research has focused on developing more effective antiviral treatments for chronic hepatitis E and understanding the long-term effects of the infection. Additionally, research continues on improving the hepatitis E vaccine and expanding its availability worldwide.